And we are live. Welcome to the Sackler School of Medicine. This is the Wiki-Med class, and we're very pleased to host Dr. Jenny Dawson. Jenny, would you like to introduce yourself and tell the students a bit about who you are?
Sure. Well, thank you for inviting me to your class, first of all. I really appreciate being here, and I just wanted to let you know that on the Wikipedia side, we're really excited about educational initiatives like yours and getting more people up and engaging with Wikipedia to share medical knowledge with the world. So I also wanted to thank you for the work you're doing to improve Wikipedia. So I am actually based out of Ottawa, Canada, and I wear a couple of different hats. One of my day jobs is that I work in clinical research for the Department of Thoracic Surgery, and we study clinical outcomes following surgery and trying to find ways to manage chest tubes to get patients home faster after lung cancer surgery. So that's my one side. And I also work for Cochrane on their Wikipedia project, where I am the resident Cochrane Wikipedian or a consultant for Cochrane on Wikipedia. So I'll pull up my presentation. Just going to share my screen. Is my presentation coming through clearly?
Yes.
Okay, great. So I just like to go through my presentation for a minute. I'll first give a little bit of background about Cochrane, and then I'll talk about why organizations like Cochrane are interested in collaborating on Wikipedia, and I'll introduce the Cochrane Wikipedia initiative. We have numerous projects that are ongoing that range from training students and volunteers, different projects to maintain and improve the quality of Wikipedia articles. We organize events to try to engage new clinicians and researchers to help improve Wikipedia. And we also have some ongoing translation projects. Now, I believe we have been working with some Cochrane reviews and learning about Cochrane through Wikipedia, but I thought I would give a short introduction about what Cochrane is. Cochrane is a fairly large nonprofit, non-government organization, and the overall aim of Cochrane is to provide people with evidence when they're making healthcare decisions. And they do so in the form of producing high-quality systematic reviews and other types of synthesized research evidence. And these reviews are quite widely used by health practitioners, researchers, and policymakers. There's different types of systematic reviews that are produced by Cochrane, ranging from interventional reviews, diagnostic test accuracy, methodology, qualitative, and prognosis reviews. And these reviews really are a summary of the clinical trials and healthcare studies, such as randomized controlled trials that have been conducted. And they're great on Wikipedia because of Wikipedia's policy of sharing high quality secondary sources. So letting another group of people organize the information and make judgments about evidence in order to inform which evidence will go on Wikipedia.
Jenny, can you explain to the students about secondary sources?
Sure, yes, definitely. So a secondary source means that the person that actually did the research is not the one who's going to go on and publish a secondary source. So a secondary source is an organization or a group of researchers, like we do at Cochrane, who comes in and summarizes all of the controlled trials and the cohort studies and all of the clinical studies that have been done, and analyzes them based on the quality and the different confounding factors the side effects and all the different things that have happened in the trial in order to have a final conclusion about the effectiveness of a healthcare intervention for researchers and clinicians and patients to understand more about the clinical picture rather than just looking at individual high-quality studies.
Do you guys any questions about that? Is that clear? Do you understand what a primary source and what a secondary source is at this point? Awesome. Jenny, go on, please.
Okay, great. So why are organizations like Cochrane interested in collaborating with Wikipedia? Wikipedia right now has over 200,000 health-related articles, in about 283 languages. And I don't believe that most physicians are telling their patients to go home and look up their conditions on Wikipedia. However, that is where people tend to be able to access information and tend to be looking from around the world. So these health-related articles are collectively read over 10 million times a day in all languages from around the world. And as an example, in the English language Wikipedia, that works out to about 2.2 billion views in 2017 of medical content. So collaborating on Wikipedia has an opportunity to actually make a big difference for the people that are accessing the content. Cochrane partnered with Wikipedia in 2014 with the joint goal of sharing high-quality evidence widely. Cochrane is presently the most cited medical journal in Wikipedia, with over 3,000 Cochrane reviews used in English Wikipedia as evidence in the articles. We have numerous projects that we participate in order to work towards sharing the evidence and improving the articles. We recruit volunteers to help with content. We do different educational outreach sessions. And Cochrane is broken down into many Cochrane review groups and fields. And so we support those groups when they have ideas and want to engage with Wikipedia. And finally, we have some translation efforts as well on Wikipedia. I wanted to give you a snapshot of some of the activity over the last 18 months of the Cochrane Wikipedia volunteers. So we have about 30 active volunteers that come in and out to contribute to the project. I recruit them using a platform called Task Exchange, in which people who are looking for volunteers and people to work on clinical research regarding systematic reviews can actually post their requests and volunteers can reply on this Task Exchange system. And so over the past 18 months, we have made over 2,500 edits. 2,500 articles have been improved. And these articles have a lot of impact in that, for example, 465 million page views have been accrued in that time. One of the main projects that I do is share a large list of views that are not yet up on Wikipedia. And so I just wanted to show you an example about how I recruit people. I try to teach them how to edit Wikipedia, and I give them the list of reviews, teach them that on Wikipedia we can't quote directly from the source. We need to paraphrase the conclusions and then find a home for it in Wikipedia where it will help improve the evidence base. Another project that I do through the Cochrane Wikipedia initiative is an effort to keep the reviews that are already used as evidence in Wikipedia up to date. And we do this through a bot or a robot that patrols Wikipedia at the start of each month and checks all of the Cochrane reviews that are already cited on Wikipedia to ensure that they are still up to date and a more recent version of the review hasn't been published. And in instances where a review has been updated on PubMed, for example, I have a list of these here, and volunteers can go through and compare conclusions and make sure that the information presented in Wikipedia is still up to date and the new review is cited in the reference list. We're just in the process right now of actually setting this spot up as well on French Wikipedia, and it's our goal as the project develops to be able to keep up to date with the Cochrane review evidence across all languages on Wikipedia. Another way Cochrane contributes is they donate library accounts to Wikipedia editors. And this actually can be quite a valuable contribution for people that do not have access to the full text of all the reviews through their library. And right now, I believe we have about 90 active Wikipedians who have library cards through Wikipedia. I also take part in numerous teaching initiatives, and I'll just give you a little bit more information about a few of them because I think they might be interesting for you and quite close to some of the things that you're doing in your class. So one of the activities I've done is I've run Cochrane Training for Wikipedians who are interns at Cochrane, so specifically Cochrane in the UK. And I've usually provide about 4 hours of Wikipedia editing and online instruction. The final session was ended with an edit-a-thon, and we find that this small group session is a really good way to actually engage participants and keep them interested in Wikipedia and editing down the road. And so in this particular case, this group of 5 editors, we actually have 2 participants that are still editing 6 months later. And one of them has just gone on to start a Cochrane Wikipedia initiative in Spanish. I'm presently teaching a course quite similar to yours for first-year medical students at Queen's University in Kingston, Canada. This course is through their critical appraisal, research, and lifelong learning block of their studies. And so similar to you, we have about 100 first-year medical students in the program. And the way we're running this course is we have them broken up into 16 groups led by a tutor who's actually an expert in a particular field. And that tutor has identified an English Wikipedia article in their field that they feel needs improvement. And then over the course of this past 2 months, the team have worked together to critique the article, so working on their critical appraisal skills in medicine, and they've made suggestions, and they're now actively improving those articles on Wikipedia. This is our 2nd year running this course, and we find it's a great way to encourage new people on Wikipedia, both faculty members and students. And the nice part is, in the end, we get 16 Wikipedia articles that have quite a few improvements out of them. Another initiative that's ongoing through a group of dermatologists and the Cochrane Skin group is that we have dermatology residents and medical students editing Wikipedia live. We've provided them with online learning resources and a large list of Cochrane reviews. And right now, actually, this group has caught up and added all the Cochrane reviews that are applicable to Wikipedia to about 40 articles. And they're now moving on to improve the articles using other high-quality secondary sources. So this is a really exciting initiative. The students seem to really enjoy it, and this activity actually counts towards part of their residency in medical school. I believe they have a component of their school where they need to actually contribute on social media. And so this counts towards part of that improvement. We find that editathons and different events are a great way to expose people to Wikipedia. McMaster University in Hamilton in Canada as well recently held an editathon just over a lunch break, and they had about 10 people who edited 8 articles. And in a short period of time, you can share quite a bit of content and give people a taste of Wikipedia hopefully they'll be interested and will be interested in also coming back and sharing more information down the line. Another really interesting group is a group of dentists based out of Scotland. They started a fairly large initiative around 2016, where they've actually integrated Wikipedia training into their curriculum. So this is fairly sustainable. Each year, the dental students get trained, and they've now moved on to training and supporting other dental schools in the UK and also around the world. Right now, a lot of the students don't seem to be editing after they finish university or after they leave the course. However, they're looking at different ways to see how we can encourage people to continue with these activities. But you can see at the bottom, they have made a lot of improvements. Over 243 Wikipedia articles related to oral health have been improved through this initiative.
Jenny, you can hide it if you click on hide on the right.
Ah, okay.
Awesome.
Thank you. And then I also support a group in Russia who are improving and actually translating some of the English Wikipedia over to Russian Wikipedia. In Russia right now, Wikipedia medical articles are an important source of health information for people who speak Russian. There isn't a lot of unbiased sources of health information. The sources that are available include some translations of Cochrane plain language summaries and some Wikipedia articles. And so you can see on the right that as this initiative progresses, there is a steady increase in number of medical articles available in Russian Wikipedia. So right now there are about 6,000 medical related articles. However, to put that into context, in the English language, we have well over 30,000 medical articles that are available for people. So I think that initiatives like this and like yours are very important to make sure that medical information is shared with people who do not have access to it. So there's actually a PhD student right now working on this project in Russia. He just started his program, and so we're really excited to see what kind of progress he's going to make and hopefully recruit some other editors as well to help.
How many native Russian native speakers do we have in class? Do we have any? At least one.
Oh, great.
Okay, two. Okay.
Well, if anyone would like me to put them in touch with any of these individuals, I would be more than happy to. There's a lot of really interesting initiatives and lots of opportunities to be engaged on Wikipedia. So I thought I would just spend a couple of minutes talking about some of the future directions of Wikipedia and our Cochrane project. We've been approached many times about different ideas to engage with Wiki Data, and I'm not sure how much your class has discussed Wiki Data. I'm probably not the best person to introduce the concept of Wiki Data because I'm not a Wiki Data expert myself. However, it is definitely an area that is very interesting to us and something that right now actually we have 2 master's students in the United States who are trying to organize the Cochrane reviews using Wiki Data on Wikipedia, and in order to help figure out where the holes are and where we can make the largest impact of sharing evidence.
Yeah, the students will have about 3 sessions on Wiki Data a bit later on in the course.
Oh, great.
Yeah.
Another area that is very interesting is trying to figure out different ways to engage academics and clinicians on Wikipedia. And one of those ways that we're interested in looking into is giving them an opportunity to actually publish their work in a journal. And I'm not sure if you've discussed this in class yet, but the Wiki Journal of Medicine is an open access journal in which you can work with existing Wikipedia editors to get some help getting your article up to Wikipedia standard. And there is this great option of actually being able to publish the journal in the Wiki Journal of Medicine. And so that's a direction that I'm very interested in taking because I think that it's a great way to encourage new editors to come in and be able to get a publication as well to help them with their individual work and improve Wikipedia at the same time. And the last part that I thought I would discuss is there are a couple different initiatives going on right now to actually assess the impact of sharing evidence on Wikipedia. A randomized controlled trial finished this summer with a Cochrane schizophrenia group who are actually looking to see how many people are clicking through and reading the evidence that's presented in the Wikipedia articles. And there's a couple different groups looking into the impact as well. So over the next year, we're going to see some pretty interesting stuff coming out, looking at what's actually happening inside the articles of Wikipedia and who, for example, is going down to the reference list and reading the full text to get more information about a particular area. So thank you again. I'd like to acknowledge Sylvia from Cochrane Central, and also Shani and my colleagues at Wiki Project Medicine. So I'm not sure how we're doing for time, but are there any questions at all that I can answer?
We have 7 minutes for questions before Emily comes up. So if you stop share your screen, oh, wonderful, here you are. Then this is a great opportunity to ask some questions. Do any of you have any questions for Jenny? Come on, be creative. Let me start by one. I'm actually curious. You've mentioned that you have another hat during the week, which is working in hospital, right? Doing research.
Yes.
So how does your Wikipedia work affect your research and work in hospital, if at all?
That's a very good question. At the moment, they are very much not related. I do follow the articles that are related to the research we do. However, one of the interesting things about Wikipedia is the importance of not biasing articles. And so if you do have a conflict of interest, like I have in thoracic surgery, chest tube management research, I tend to steer clear of making large improvements to the articles to make sure I don't bias that work. That being said, people who are in those areas of research can provide very valuable feedback to articles and make suggestions of excellent sources. And so I actually, in the future, I hope to be able to contribute even through my conflict of interest. So fully disclose that, yes, I am involved in clinical trials related to this type of research. However, I would be a good person because I know a lot about the secondary sources that are available. I know where all of the high quality information can be found on the internet to help improve the Wikipedia articles. So I think that people like me who have a specialization are actually valuable on Wikipedia. And in the future, I hope to be able to contribute a little bit more in that field. However, right now, I keep them fairly separate in order to make sure that I don't have a conflict of interest on Wikipedia. But I should note as well that I'm actually a research associate in that field. So I'm not the primary investigator on these studies. I work about 8 hours a week on this project. And I'm more involved with the manuscript preparation side of things. So I think that my conflict of interest is not especially strong anyways in that area, but I will have a lot to contribute with my knowledge of the field.
Yeah. There was a question here?
Yeah. Does Cochrane give a conclusion or just statistics about the articles?
Did you hear?
I only heard half, actually. Would you mind repeating it?
Can you stand up?
Yeah. Well, does Cochrane really give a conclusion about the articles or just statistics? Like what, where, or what?
Does Cochrane provide with any review that you give? Do you actually give results or do you only describe the statistics?
Very good question. Most reviews, that have strong amounts of evidence base will actually have a result. And so if you read the review, you will see that approach A is better than approach B, for example. And so that's very useful information that we share on Wikipedia. However, in a lot of fields, unfortunately, the evidence base isn't strong enough to have a strong conclusion. And in those cases, the evidence will be presented and you'll see a scale of evidence. So you'll see, for example, there's weak evidence to suggest that A is stronger than B. And there will also be some indication other aspects other than just efficacy. And so you'll see information about side effects, safety, and various other parameters surrounding a particular intervention.
Did you get an answer?
Yeah.
Wonderful. Anyone else? We have time for at least one more question. Then I would like to ask for the class, actually, for you to share a bit about your experience working with the Wikipedia community. Some people really struggle, especially newcomers to Wikipedia. It could be very daunting to and scary to start editing, and people are really used to having ownership of the material they write. So suddenly, working in an environment that is collaborative, that someone can come and change your edits, is scary. It's especially for students who don't feel that they're still experts. So do you have any tips for beginners in Wikipedia in terms of how to really work well with the community?
I think the important thing to realize with Wikipedia is that because we're human, we're going to make mistakes. We all do. And so if you're coming in with good intentions to improve the articles, you have high quality citations, and you are there for the right reasons, you don't have a bias that you're trying to manipulate the article for your own self-worth, I say just dive in and make the edit. People on Wikipedia do realize that we will make mistakes. So we all do on a regular basis. And if you do make a small mistake, it will be corrected by the community. The important thing to realize is you being there and sharing that information is the most important part of Wikipedia, and it's absolutely essential for Wikipedia to survive, is having people come on and share evidence. So I would not get too hung up about the small mistakes, where your citation goes before or after the period. Any of that stuff isn't as important as the high quality sources and the knowledge that you're bringing to Wikipedia. And so if you keep that in mind, and even if someone changes your edit, that's fine. That's how the community works. Even if you've made a mistake and perhaps your edit's been reverted, what you won't realize is that you just being there in that article will actually bring some high quality editors to your article who may actually make other revisions while they're there. And so any of your activities on Wikipedia are not wasted. And I think if you keep that in mind, that should help. I found I was nervous for my first edit. You're not wanting to press the submit button. However, I also find it really interesting and fun because you often do get immediate feedback, and the learning process can be quite quick on Wikipedia because that feedback can happen so quickly. And so I encourage you to track your edits and, like me, learn from the little mistakes that you're making along the way. And I think that it doesn't take long if you follow those small mistakes to become a really strong contributor on Wikipedia.
Wonderful. Any other questions from class? Okay, so Jenny, thank you so much for joining us.
Well, thank you for having me.
Yes, and we will stop the broadcast. Actually, we won't stop the broadcast because we have another guest, Emily, who should be here soon. So let me just, you're very much welcome to stay if you have time. If not, that's fine. Let me just ping Emily. In the meantime, while we wait for Emily to join us, I would actually love to hear why you think it's important for med students to even engage in Wikipedia, especially as they don't have so much medical knowledge, especially not in first year.
Well, I mean, I think that sharing knowledge is so important that people at all different stages of their training can contribute. So I mean, all of us can read the literature, and the nice thing about Wikipedia is we don't need to make judgments whether a specific clinical trial is strong or not, because we rely on those secondary sources. And so trainees at all different stages in their training can actually make quite significant improvements just by using those secondary sources, paraphrasing the conclusions, and finding a home for them in Wikipedia. I also think it's really important that we realize early in our training the importance of providing people with this quality information. Whether we like it or not, many, or the majority of people are going on the internet and looking for answers before they come into the doctor's office. And so this is something that you'll see yourselves in 8 years down the road, that you'll have patients coming in even with a printout of a Wikipedia article saying, oh, I've read this on the internet and I think I figured out what's wrong with me. And so the more we can promote people to improve what they're reading on the internet, the better. And so I think it's great that you're becoming involved this early in your training to realize the importance of sharing that information, and the information that's shared being of high quality, because it can actually save lives. So I think that for me, that's what I feel when I teach, and I think that realizing how many people are impacted by what seems like a small amount of information in a Wikipedia article is quite amazing.
Awesome. Thank you for that. Hopefully Emily is going to join us real soon. Let's see if she's answering. We are going to make one last. אני מנסה לחבר את אמילי בפעם האחרונה. אם זה לא ילך, אז אנחנו נמשיך את השיעור עם דברים אחרים. Okay, it seems like Emily is not online for some reason, so we will stop the broadcast. Jenny, thank you again so much for being with us, and hope to see you soon, and looking forward to seeing all the great work you do with your students.
Thank you. And I'm looking forward to following your program and initiative and seeing the improvements to Hebrew Wikipedia as well. As I said, we're really pleased that you guys are here contributing, and I really look forward to your work.
Thanks so much.
Thank you.
Bye-bye.